Phantom back. Callus Care. Okay, there's various kinds of calluses that are located throughout the entire foot. This specific kind of callus is a pressure type callus, also known as an IPK, intractable plantar keratosis. With these kinds of calluses, it's best just to debride the callus. I use a number 15 blade in this case, followed by a hydrating lotion of some sort, something with urea usually is suffice. It's very important to keep tension on the skin surrounding, as you see here with my thumb. I do this in order to keep the skin taut so it will not fold over and accidentally cause a injury to the skin. And you slowly work your way around. You will see I will periodically run my thumb over the hyperkeratotic lesion to determine how firm it is. That usually determines how much callus is still left, and you could compare it with the surrounding skin, and you could see this focal point on these types of calluses. That is where the hyperkeratotic core is located. Some people are aggressive and remove this hyperkeratotic core. Also, these are usually caused by a plantar flexed metatarsal, and also a hammer toe may also assist in causing plantar flexion of the metatarsal, and then you have this increased amount of hyperkeratotic tissue. Other ways to alleviate the pain and discomfort in regards to these types of calluses is to utilize a accommodative or functional orthotic with a lesional cutout that offloads this area and can be easily transferred from one shoe to another. Usually I will have the patients obtain an over-the-counter orthotic, and on occasion I will also use the orthotic that they currently have in their shoe, mark this area with a erasable type marker right along the hyperkeratotic core, have them ambulate, and it will mark the exact location of this pressure point, and it will offload this area. Doing this in combination with a hydrating lotion will significantly decrease the development of hyperkeratotic tissue. This may not entirely alleviate this hyperkeratotic lesion, but it will significantly assist with overall pain and discomfort without surgical intervention. Here you can see this is a pinch type callus, usually located on the outside of either the great toe or the little toe or the fifth toe. Same treatment, remove all hyperkeratotic tissue. Once again, you will see me utilize my thumb to compare the core of the hyperkeratotic lesion to the surrounding skin until it is nearly even. Here is another intractable plantar keratosis, and in Spanish also known as the ojo de pescado or fisheye type lesion. These are a little bit tougher, especially when the core is very firm. You may have difficulty removing this section of the skin, and you have to ensure that the 15 blade is sharp and hold tension on the skin as you debride all hyperkeratotic tissue. Please don't forget to subscribe and like the channel if you like this content and you want to see more. So with these kinds of intractable plantar keratosis, it usually takes approximately 4 weeks to 6 weeks for these hyperkeratotic lesions to begin to fade. Here you see the hyperkeratotic core. Slowly but surely we will continue to debride. I personally do not like to attempt to remove the core It is very difficult. Some people also would like these surgically removed. I do not recommend that, as if they are on the plantar surface on a weight-bearing area, the surgical scar may cause more pain and discomfort than the actual hyperkeratotic core. I have had several patients over the past 20 years who come in every 2 to 6 weeks. I provide a debridement of the hyperkeratotic lesion, and over 6 weeks to 8 weeks, they have significant improvement and decreased pain. This particular callus, of course, is in a diabetic that cannot feel. If you continue to walk on this hyperkeratotic core, it will eventually create a blister. This one is a fluid-filled blister with blood, which will eventually become an ulceration. That's why it is important for diabetic patients to continuously check the bottom of their foot for these kinds of lesions. This type of callus is a little bit more difficult because it's actually an ulceration. I approach this differently and remove the hyperkeratotic tissue circumferentially around the fluid-filled blister until the surrounding skin is at the same level of the ulceration. There you can see the purplish discoloration where the blood has become a bruised type lesion, which is removed, and beneath it is healthy appearing skin. There's no signs of purulent drainage. And all hyperkeratotic tissue has been removed. In support of the channel, I have provided several links below which describes the actual setup that I have in creating these videos, which several subscribers has requested. And please do not forget to subscribe, like, and follow. Here you see an additional pinch callus with a underlying area of light purple discoloration, also indicating increased pressure and possible underlying fluid-filled abscess. Upon debridement, we see no signs of purulent drainage as we did on the previous ulceration. It's also important when you're debriding these kinds of lesions to ensure that you have adequate protection. I use a face shield as well as a mask and a gown as well. Here, once again, I work my way around the area of light purple discoloration and remove the hyperkeratotic lesion. This is the same patient, contralateral limb. This is a hyperkeratotic lesion, which, if left alone and untreated, it may cause the same kind of lesion that we saw on the right lower extremity. With these kinds of wounds, with this diabetic patient, it's very important to have the patient follow up on a weekly basis to ensure adequate healing. As I have described in other videos, it's very important to provide wound care orders for dressing changes to be performed by home health. If you like this video and you want to see more, please subscribe, like, and follow. Foot Phantom out. See you soon.